Earlier this year, I started an anti-aging journey. This was because I took a biological age test. It supposedly measures how old you are on a biological level. I took this right before my 29th birthday and found out that I was 36 on the inside, which was 7 years older than I actually was. So I naively jumped on TikTok and asked people to tell me how old they thought I looked. The consensus was in line with my biological age, which was 36 to 37 years old. Now, because of my high biological age, from a health standpoint, I decided to do two things. One was to take science-backed supplements that were theoretically supposed to help decrease my biological age by following Dr. David Sinclair's protocol. David Sinclair is a Harvard-based scientist who does research on aging and epigenetics. His protocol includes NMN, resveratrol, quercetin, intermittent fasting, exposure to extreme temperatures in the form of a sauna or an ice bath. Most of his research has to do with stressing the body just enough to kick on something called sirtuins. So along with Dr. David Sinclair's research, I followed somebody else's research, Dan Buettner. Now, if you recognize him, that doesn't surprise me. Last year, he came out on Netflix with this documentary of Live to 100 Secrets of the Blue Zones, which are hotspots in the world, the highest concentration of centenarians, or people who live to be over 100. I decided I wanted to try to eat like people in the Blue Zone, see if it could help me decrease my biological age, make me feel better overall. I did have several health issues, because of the fact that I have lupus. I'm going to be eating like people in Blue Zones to see if I can reverse my biological aging clock. You might have seen that video that I did back in October. However, despite the fact that in those 4 months that I did eat like people in the Blue Zone, my symptoms with my autoimmune disorder almost completely vanished. I had one flare-up during that time that lasted less than a week, which is the longest span of time that I've gone in about 10 years without having a very big flare-up. But despite that, my biological age essentially stayed the exact same. From 36 to 36 and a half, I decided to try something different. I decided to test my luck in the realm of Hollywood fitness and trendy wellness in general. For this 6-week body transformation, I did a celebrity personal trainer's at-home program. You might recognize Steve Zim. He's been in a bunch of viral YouTube videos, body transformations with people like BuzzFeed, Michelle Carr, and Olivia, who did the Glow Up Diaries. At-home program is called ATU Mobile. All the results were almost shockingly effective, gaining muscle around my shoulders, dropping 2 to 3 inches around my waist, dropping 4 inches around my mom poo, growing out my glutes almost 2 inches. I recently retook my biological age test. While I may physically look like I am in the best shape of my life, my biological age is 40 and a half. Here's my theory as to why. I followed the guidelines in Steve Zim's nutrition book, Superhero Nutrition, in direct opposition to the Blue Zone. I ate meat regularly. Both Steve Zim's program and the Blue Zone specify diets that control your levels of insulin and keeping your blood sugar stable. I think the only very big difference I saw, the differentiation between one having meat and the other not, as well as the Blue Zone specifically incorporate a lot of herbs. How many recipes in the Blue Zone cookbook that have a good amount of potent herbs, I think, is one of the reasons why it was the most effective in controlling my autoimmune symptoms, as well as making me feel good overall. I feel like a lot of people underestimate the power of herbs. I think when we think of antioxidants, we think of something like blueberry. That does have a very high amount of antioxidant. Blueberry's antioxidant value sits at around 6,500. Found cloves, however, ORAC value of 314,500. Almost immediately after I stopped eating like people in the Blue Zones, my autoimmune symptoms came back tenfold. I had one of the worst autoimmune flare-ups that I've ever had. My positive ANA titer ratio was by far the highest that it's been. I started having other symptoms of a secondary autoimmune disease called Sjogren's, which I found out that I had after going to the doctor because the size of my face started to puff up. I absolutely don't blame the fitness program or Steve's diet guidelines in general. If you're looking for an aesthetic transformation of sorts, he is absolutely the guy that you should listen to. I did toy with the concept of meat because I wanted to see how big of a difference it made in my health. And it made a big one. While measuring your biological age, kind of in its infancy, in the grand scheme of things, I've decided to go back to the Blue Zone diet while staying on Steve Zim's workout program because it only takes 30 minutes a day. Building muscle is important when it comes to longevity if you look at the research. Going back to eating like people in the Blue Zone, this time I'm using one more indicator, how it's affecting my health. After my big flare-up, my ANA titer went down to 1 to 320. The higher this ratio is, the worse your autoimmune symptoms are. After eating like people in the Blue Zone, I'm going to retake this blood test. I'm also tracking one of the numbers that matters the most when it comes to health and longevity, is your cholesterol and triglycerides, both of which, according to last week, my numbers are high in. High cholesterol and triglycerides can increase the risk of heart disease and stroke, which are the 2 leading causes of death in the United States. It accounts for 1 in 5 deaths. It is wild to me. There are so many buzzwords in the realm of health and fitness. Preventing heart disease isn't one of them, at least that I've heard in the realm of millennials and Gen Z. Maybe that's because we're young and we think that we're immune. It's important to know that heart disease also regularly affects young people. The prevalence of heart attack deaths among people from the ages of 25 to 44 increased 30% over the first 2 years of COVID-19. That has to do with COVID-19 itself. The lifestyle and diet habits associated to what we've switched to after lockdown unclear. Blood work that helps measure your heart health, such as cholesterol and triglycerides, seems to me to be a good indicator whether or not eating like the people in the blue zones might actually help me live longer. To make eating like the people in the blue zones even easier, the first time around, I downloaded the Blue Zone meal planner. It gives you tons of different options that you can pick from. You can compile into a list of meals that you want to try for the week, which then puts the ingredients that you need into an itemized list I can easily check off. Make sure that I get everything that I need to prepare for the week. I have recipes from Okinawa, Japan, Sardinia, Italy, Paria, Greece, and Loma Linda, California. Yes, there is a blue zone in the United States. That always surprises people. We'll retake a biological age test at the end, probably the next 3 months and then 6 months. We'll also do updates on how my autoimmune disease is doing, the only intervention being changed, going completely back to the blue zone diet, as well as adding in a little bit more natural movement. Go on walks. I miss doing my walk. I did because of the blue zone research. Others good enough to do it again. And we're going to see how my cholesterol and triglycerides do and see if they are lowered eating like the people in the blue zones. I'm not sure I look 40 anymore. I'll be very honest and say that this age does align with how my joints, energy levels, and autoimmune symptoms feel. Is that contributed to a lack of herbs and meat? Or is there just something magic in the blue zone diet itself? I guess we'll find out. I'll see for blue zone recipes and some deep dives into every blue zone. Till then, catch you in the next video. Also, how old do we feel I look now? Do I dare ask that question again? I did. Let me know in the comments. And we'll see if we can decrease it even more by eating like people in the blue zone. Because I do feel like it gave me a glow before that I might not have anymore. I guess we'll see.